Hi, I'm Grace Miller. I am a second-year DVM MPH student, and today I'll be talking about the spatio-temporal analysis of raccoon rabies animal cases in eastern North America. The raccoon rabies variant is endemic to the East Coast from Florida to Maine. More is yet to be understood of the disease dynamics of this virus. Therefore, the main objective of this project is to determine if a variation exists along the latitudinal gradient and/or with human population density. Using passive surveillance data from the CDC and USDA years 2006 to 2017, we first aggregated the data sets, looking at the total number of samples and the number of cases per county per month, along with the urbanness of each county. We then ran a negative generalized linear model, or a GLM. The GLM analyzed the case counts to our covariates, urbanness, latitude, and month, with the total tested used as an offset to control for the number of tests per month. The results, we first plotted the actual data, so the case counts over the total tested versus latitude, and then the case counts over the total tested versus urbanness. You can see from figure 2 and figure 3, there are really no trends seen in the data. Looking at figure 4 and figure 5, we plotted the predicted from our model. So we have the predicted case counts over the total tested versus latitude, and there is a trend with a higher predicted number of cases in the lower latitudes, and then the predicted cases over total tested versus urbanness, where there is somewhat of a trend, and you can see there's a higher predicted number of cases in rural areas. Therefore, from these preliminary results of the negative GLM, we can predict there will be a greater number of cases in areas of lower latitudes over higher latitudes, and more in rural areas over urban areas. On the other hand, this trend is not seen in the plots of the actual case counts per test. In addition to an R-squared of 0.009, we can hesitantly assume that the model used was not an ideal fit for the data set. Therefore, further investigation needs to be done. From here, we plan to run a hurdle model analysis, which will better account for the counties that never had a positive case during the time period of 2006 to 2017, and will hopefully provide a better linear fit for our data set. The outcomes of this model can help guide future rabies surveillance and control efforts to assist in reducing the spread of raccoon rabies on the endemic East Coast. I would like to thank the University of Minnesota College of Veterinary Medicine Summer Scholars, and a big thank you to our collaborators at the USDA and CDC.